Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel, today we're going to be talking about root canal specialists. Let's start. So today is going to be a very interesting episode. Why I am talking about root canal specialists that are endodontists. When you break down the word endodontics, it basically means the science of studying of all the internal structures inside the tooth and the pulp. So I've already published a video about how most of the severe tooth pain is usually pulpal pain. That means it is a pain involving a tooth where the infection of the decay has spread right from the enamel to the dentin, and it's reaching close to the pulp, or it is going to the root apex, and thereby it is causing severe pain. Now this kind of pain management is treated best by someone known as a root canal specialist. Now I understand a lot of times that because of the proximity of any regular or general dentist, we tend to go to them, but however sometimes because of the RCT being treated, for whatever reasons the RCT is not successful, where do you go at this point of time? For getting a RCT, for getting an endodontic evaluation, for getting the best root canal treatment amongst all the types of dentists, you need to go to a root canal specialist. These are specialist dentists who have been trained in their masters for dentistry for 3 years or plus more than that, with their different diplomas or any sort of accolades, where they focus mainly on pain management, the diagnosis of pulpal diseases, that means the decay inside the tooth, any sort of root canal treatments, the material science behind caps, the material science behind fillings, the science behind how to do a drill, fill, the basic bread and butter of dentistry. These are also equipped with how to do periapical surgeries, apicoectomies, which are basically much more serious and surgical procedures that require more intervention than the regular RCT. They are very good at doing re-RCTs. They're good at, if there is an instrument breakage, they're good at either retrieving or bypassing the file. On top of that, they have a huge armamentarium which they are trained to work with, including rubber dams and isolation. They know the material science about the filling materials, and they know how to handle pain in the utmost manner when it comes to pulpal pain. So if you are having some sort of confusion that I am having some severe sort of tooth pain which is pulpal pain, you can go to your primary dentist, that's all right, but if you want the best treatment, I would highly recommend that you go to a root canal specialist who have been trained vigorously to treat pain, to treat the nervous system, the root canal system of the tooth, to make sure the periapical infection that is kind of eating away the bone below the infected root canal is taken care of, to make sure that the post and core after the root canal treatment and the crown is fabricated properly, and finally to rid you of all the oral discomfort that is caused by all the diseases which are caused by microorganisms that occur inside the tooth. So that's it for today. Please like, share and subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles and my WhatsApp number. However, I would really request you not to call me directly, as I might be busy with patients. Just drop me a message with your name, your place and your chief complaint, that is your dental problem, and then I'll get back to you within a couple of days. If you have any doubts, queries, apprehensions, criticisms, suggestions, or any sort of insights, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.